afternoon, viewers, and welcome to Health 360. I'm your host, Alicia Martin. With me, I have Dr. Pedro Lewis, the Director of the National Blood Transfusion Services. Welcome, Dr. Pedro.
Thanks for having me on your program. Thanks a lot on behalf of the Blood Bank and the Ministry of Public Health.
Thanks for joining today. So our topic for today is COVID-19 and blood donation. But before we get into that, Dr. Pedro, could you tell us of some of the services that you guys offer at the National Blood Transfusion Services?
Oh, great. Of course, the National Blood Transfusion Service, the entire Guyana know, we just have one blood bank in Guyana, but of course, we have several collection sites. Um, the main branch, which located at Ramani Street in the Georgetown Public Hospital compound, this is where we do collection, we do processing, we do screening of the blood, we do separation, and we also do distribution to several private health facilities, and also public health facilities, including the regional hospitals. Our collection sites in Region 3, Region 2, in no order particular, Region 10, in Region 9, and Region 6. These collection sites, what they do is just collect the blood and they transport it to Central Georgetown, where we do the processing of those units, and then we distribute back those units of blood for the usage in the region. Um, of course, around this time, everybody know with the pandemic of COVID-19, commonly known as the coronavirus. This is really at this time brutal on the National Blood Transfusion Service, simply putting it. Of course, we have a reduction in demand of blood products, but we still, and I need to emphasize on this, we cannot stop severe illnesses. We still have accidents on the road, everybody will know. We still have a lot of high-risk mothers around this time. Only 2 evenings ago, we had placenta previa of risk of bleeding. We had ectopic pregnancy. These pregnant mothers need very large amount I must say, um, a fair quantity of units of blood in order to save their life. And there's only one way we could get it, and of course, it's from our voluntary donors
Yes.
across Guyana.
Okay, Dr. Pedro, what is the National Blood Transfusion Services doing in response to COVID-19?
Yeah, so in response to COVID-19, nothing much really changed in terms of our um, how we actually collect these units of blood. Um, we have some small amount of changes in respect to the policies, or we should say, or donor selection policy, in that we know almost every single country is being affected by this COVID-19,
Yes.
including Guyana. So we cannot actually rule out poison when it comes to epidemiology in respect to which country they come from. We know exactly so that our reports or entries into Guyana at this moment are closed. Um, so practically there's no one going in and no one going out at this moment. So we cannot really use epidemiology in the sense that um, we tend to defer persons coming from a country that is affected, because almost every single country is being affected at this moment.
Yes.
Um, there's no actual evidence there that this particular virus is being transmitted through blood transfusion. Right? There's no evidence that this virus is being transmitted through blood transfusion. What we know the fact that majority of the persons may have this virus and they are asymptomatic. So what you will see at the National Blood Transfusion Service, and we don't want our voluntary donors to feel no kind of way that you will see our staff protecting themselves. Right? We know that of course it cannot be transmitted through blood transfusion, but we don't want it to be transmitted from individual to individual. So you see that our staff taking very special precautionary measures to um, prevent that spread from person to person. So they will have in their possession their PPEs, and of course there will be less talking during the process, right? They will also wear their shields and so on to prevent um, droplets with this virus from transmitted from persons to persons. Of course, before you comes into the blood bank, there's a sink there for person to wash their hands. Also, we have a mat there where person to wipe the feet or the sole of the shoe so as to prevent them from entering the building with this particular virus. Also, you ask you questions like um, your travel history and so on, despite the fact that um, the entry into Guyana, all the entries are closed. We still ask you questions because remember, our criteria not based only on COVID-19. There's so many other things that we look for. Right? There's so many risks, and we all know that these questions is the most important thing
Yes.
or the most important part of the blood bank procedure. Because what we do, we try to eliminate the risk, right? We don't label no person. All we want to do is that we want to make sure that we have a safe unit of blood going to a particular patient. It could be anybody relative, right? Is our objective here. There's nothing wrong if you tell somebody, hey, you might probably have a risk of transmitting hepatitis B with a person, and we tell you, Mom, come back in the next 12 months and try again, return and donate. There's nothing wrong with that. A lot of persons did that before, and there's no hard feeling in that. So it's not just COVID-19. Um, we try to eliminate the risk of transmission, so many other infectious disease. So it's very important that we ask you questions. We will question you at the blood bank for your sake and also for the patient's sake. And I could give you example where it's important for you. You might probably have a bleeding disorder, and you cannot donate. Right? And we ask you, and we try to prevent it. We put the needle, and you start bleeding and bleeding and bleeding all the time. So in that way, we protect our donors, right? And there are many other ways where we protect our donors, right? So it's very important that we ask questions
Yes.
before we actually extract the units of blood. So with the COVID-19, of course, things are difficult. A lot of persons don't know this information that you could actually still come to the blood bank and donate. We ask that you, of course, wear your mask, still follow the Ministry of Public Health guidelines, right? It's very serious. We want you to still follow the Ministry of guidelines. Um, you- um, Make sure that you 6 feet away from persons and so on. We still call donors, right? Especially at this time, we try to try to call donors, and many of them may respond like, we don't know, you still could come and donate blood, right? And this is the reason for this thing. We really like to appeal to person that it's very important that you still donate. We cannot tell somebody or tell a mother to wait. Don't deliver now, a high risk mother. Don't deliver now. Wait till the next 2 months or so. We cannot say that, right? We cannot predict what will happen to an individual. Right? So we at this moment we critically need our voluntary donors, right, to support us and to support their.
Okay, so for those persons who may have joined the program late, could you emphasize a bit more on why it's important to donate blood at this time with COVID-19 and all that's happening? I know persons are practicing social distancing and they may want to stay home from work and from all their daily activities and so forth. So could you just explain a bit more on why it's important to donate at this time, even with all that's happening?
Yes, I'm happy to do that. Um, Even with all that is happening now, with the social distancing and all of that, you could still go into the maternity unit and you will still see mothers there. You cannot blame them. They're pregnant. We don't know. Of course, the doctors may evaluate them and say that they're high risk and so on. And the blood bank must play their part in the sense
Yes.
that we must collect safe units of blood and have it here at the blood bank in case of emerging and so on of these models. Um, Persons still, of course, we still having accidents. I'm reading we still having accidents on the road with individuals that probably have fracture here, fracture femur, and so on, risk of bleeding. And these are emergency surgeries, right? These are emergency surgeries. They just cannot wait, right? These cases just cannot wait, and we need person to come in and donate. Remember, the blood bank is not a factory. We don't manufacture blood. You cannot go in a supermarket and purchase blood. That's a fact. You cannot, right? We depend on our voluntary donors, and I could see that we have a lot in there, and we have more than 20,000 voluntary donors in there. So we have our stipulation, like I mentioned before. We will not allow crowding into the blood bank. We will not. Um, our donors are special to us. They all know that. We treat them very well. Um, Everything remains the same, but we're going to follow the Ministry of Public Health guidelines in terms of the prevention of this COVID-19, this dreadful disease, right? So, yes, we don't want this disease to infect a lot of persons in the population, but at the same time, there are other things that could take Guyanese life. For example, a bleeding mother. You thinking about a bleeding
Yes.
mother, you think about losing a mother, is you're losing the entire family. Family becomes dysfunctional after that. Dysfunctional. Because that mother may have 6 children, right? The husband is there, he probably might turn to alcohol, right? To turn to the bad side, and there's 6 children there just be there on their own, and that's it. A dysfunctional family. So it's very important that we protect our mothers, right? Very, very important. So I need a message to go out here that no matter with the COVID-19 and so on, the coronavirus and so on, you could still donate blood. And WHO predicts that we will have a problem when it comes to blood donation. But it don't necessarily mean that Guyana must have a problem, right? We have good people, we have caring citizens, we have caring donors who donate throughout the year. And I must say, um, before this actual COVID-19 pandemic, at the starting of March, I think our numbers in terms of voluntary donation were double as to last year. We had a very, very good year. Starting of a good year, I should say. It was excellent. I was already thinking about um, distributing blood to some new areas and so on. I had a lot of plans, and all of a sudden, this pandemic hit us. I think it was very, very, it's disappointing to me. It really wrung my spirit. But at the end of the day, we have to face these kind of things, right? And move on and work.
Yes.
So it just brings us to the point that we now have to educate our donors and so on and try to reach out and give them confidence. I know a lot of the donors are very scared. I have witnessed it. I call a few of them. They're saying that, Doc, I have my mom at home. She's 90, and I'm very, very scared to come out and doing it. But and I will advise them to take the necessary precautions. Um, Before the Ramani Street entrance gate was closed, now it's open. So, for instance, as soon as you enter the Rama entrance, you get straight into the blood bank. Into the blood bank, you don't spend more than 50 minutes there. Less than 50 minutes into your transportation and back home. So if you're leaving your home, it should be right. So you come into the blood bank and doing it. Blood. It's very, very critical. Right?
Okay, so we know that 1 unit of blood can save up to 3 lives. So that's an important point that person should know. You donate blood and you never know who life you might be saving with that 1 unit. So definitely you should go down to the National Blood Transfusion Services and donate blood. We always need blood. So just for clarification, for those persons who might be wondering, can I contract COVID-19 by donating blood? Could you explain that, please?
No, like I said before, we taking the necessary precautions because the only way you could see the transmission is probably from person to person, which is my staff and probably
Yes.
to the donor. That's why we are advising the donors to wear the face mask. My staff are well protected. I know that. They were given all the protective gears, the PPE, and they are protected. So the donors should protect themselves by wearing their face mask when they come into the blood bank. This is totally okay with us. That's your right to protect yourself. Um, of course, when we're doing the interview, um, our donor attendants will have their shield. But there's no way that droplets will probably pass as shield and go to a particular donors, right? We know there's steer and so on, so we took all the necessary precautions, right? All the PPs and so on, the staff are here, and yeah, I don't see it transmitting from person to person through blood donation. Of course, cannot pass you the blood basically.
Okay, so for those persons who might not be feeling too well, might be sick, could that person donate blood too?
Yeah, and I like the question. Very, very important question. You have to remember that in Guyana we have 98% or 100% voluntary blood donation. We're a very lucky country, right? Very, very lucky. And I could tell you, all the voluntary donors know, right? Or questionnaires, they know precautionary measures, they know some of the illness um, that is out there, and they know they cannot donate with certain symptoms and certain signs. For example, they know for a fact that they cannot donate blood if they have a fever, if they have a cough, right? So you will never find them, especially with our voluntary donors. Probably you might probably find it with somebody who donating for the first time. But with our voluntary donors, they know that they cannot come to the blood bank if they have a fever or if they have a cough, if they have a temperature. They know they cannot donate, but they know it will be before. So you know, if you're not feeling well, there's one of the first question that you ask you. If you're not feeling well, please don't come and donate.
Stay at home.
Just stay at home until you're okay, and then you could come down to the blood bank and donate. Of course, if you're a donor, you're probably in contact with somebody. If you're a donor, you're probably in contact with somebody with COVID-19. Um, you have about 4 weeks deferral. Deferral is about 4 weeks, I think 4 to 5 weeks, and then you could come and donate. Right? The important thing is to get you out of that window period, right? And this doesn't actually go along with COVID-19 with all the rest of the infections. The objective is to get you out of that window period, and then you could come and donate, right? Very important. And in this case, that we don't want you to transmit it to probably to somebody in the blood bank or somebody is there to donate
Yes.
also. So very important.
So what are the requirements for donating blood for those persons who might be considering to come down to the National Blood Transfusion Services?
Yeah, there are persons, regular first-time donors who say that we come down to the blood bank and donate. And for persons who are thinking about stepping into this milestone of starting donating blood voluntarily, it's very simple. The procedure is simple. The criteria are very simple. Of course, you must be the age of 17, between 17 and 65. If you're 16, you must have parental consent. Um, you must weigh 110 and over, or 50 kg and over to donate blood. Um, there are some technical questions we will ask, and the question that we ask is exactly what I explained before. Is that we ask you questions related to risk factors of infectious disease, and it's important that we get you out of that window period. It's very important. Ask if you feel well, if you have a fever, and so on. If you're taking medication and what medication you're taking, if you're suffering from any particular illness that could harm the patient, and so on. We ask you questions about that. So it's very simple. Once you start, you could donate every 57 days. You could come down to the blood bank and donate. And now persons could even be plasma donors, platelet donors, because of our new technology, apheresis technology that we have, could actually extract plasma alone from a particular individual, and all the rest of products return back to you. Right? So we have the technology, we have a lot of requirement there in terms of voluntary platelet donors. It's very important too. We have a few leukemia patients, especially in the PEDS unit, that need a lot of platelets so that the doctors could um, try and diagnose these patients, do the bone marrow aspiration. And you know, you platelets come quickly, you have a risk of bleeding and so on. So the doctors need most of the time to raise a particular individual platelet count before they could actually do the bone marrow aspiration. So lately, we are having a lot of demand for platelets. It's not like before, where you might have maybe you might need 20 something donors just to get the particular creators to raise somebody created. So one or two persons and it's okay.
Okay, so for those persons who desire to come down to the National Blood Transfusion Services and donate blood, but they may want to bring their children because they don't have anyone to look at them at home, could they come with their children?
Yes, it happens a lot. A lot of persons bring their children along with them. It happens a lot. And what I found out is that most of the voluntary donors do that to to donate blood, and it's amazing. Most of these children they just can't wait until they reach at that particular age to start donating. So they will bring them to have a look, to
The
experience
process, yes.
um, the parents, right? To experience the process, the experience seeing their parents and mom, their dad donate, but doing such a good thing. I think this one the reason you will see a lot of donors, especially the voluntary donors, would walk along with the children. I think it's a good thing. Nothing wrong with that. Of course, they will take the necessary precautions, but if they could avoid it, it's okay.
Okay, so before we close the program for today, Dr. Pedro, do you have any word of advice for all persons coming to donate blood in terms of precaution, methods that they can use to protect themselves from COVID-19?
Before that, the blood bank, I mean, Ministry of Public Health. I just want to show, my appreciation to all the health workers um, who are on the front line, right? To this dreadful disease. The nurses, the doctors, most of them are my colleagues. Um, we had Naiman Hospital, West Hospital, even Georgetown Public Hospital, even for fetch areas, the regional hospital. Um, just want to tell them to be careful, make sure that you use your PPEs. And we really appreciate what they're doing. And if everybody do their part, the work will be so simple. So we are the blood bank, of course. We on the front line too. I just can't forget the staff of the blood bank, especially the ones that are in contact with donors. And it's a disease that is, um, most of the persons are symptomatic. Um, so we don't know person walking around with it and we just don't know. So my staff also, the staff at the National Blood Transfusion Service also on the front line. And just want to show appreciation to those health workers out there.
Yes,
Um, to the donors, really, for me, I always like to say thanks to the donors. Anytime on a program, I really like to say thanks to the donors. Um, yes, before now, you know, the, like we always say, you come down, it only take you 50 minutes, but they are taking a chance now to come to the blood bank and donate a unit of blood. It's an extra chance that you're taking. Um, on behalf of the patient, we really appreciate that. It will make the health workers' job easier, far easier, because just knowing that you have a lot of products there in stock, eventuality of a bleeding and so on, it kind of ease the tension a bit, knowing that I mean, any one time someone may be in need of blood. Any one time, you could be walking on the road and you never know,
yes,
right? You never know the donation might be for you, right? right? The same person that is donating his blood. You never know the blood unit might be for you. So I think it's a serious thing to consider everybody in the population, everybody, if you can, right? If you, I mean, you have the criteria to donate, I don't see a big problem. It's a very easy process. I never come across nobody dying from blood donation. There's not a lot of blood be taken out of you. It's less than a pint of blood, right? So I think if you can, you should donate. You should, right?
Definitely.
And it's not only in Guyana. Right now it's difficult. It's difficult throughout the world. United States. I could imagine what goes on in the Caribbean countries too. It's difficult. Please, appealing to person if you can, please come down and donate. And I mean, you're helping the patients and also you're easing some of the tension of our doctors and our nurses knowing that we have a stop here in the eventuality of any accident and so on. We have stop here, right? So, I mean, our part, this is the part that we play to just appeal to persons to come and donate, and that's it.
Thank you for joining me today on the program, Dr. Pedro. I want to encourage you to keep up the good work that you guys are doing down at the National Blood Transfusion Services, you and all the staff down there. Thanks once again. So this has brought us to the end of
Thanks. I
program
hope
for
everyone will get
today.
a
For
message.
all those persons who are viewing Health 360 and listening to us today, we want to encourage you to donate blood. 1 unit of blood could save up to 3 lives. Donate blood even during this time. All staff are taking the precaution methods, and you should too. Thanks for joining us for today. Goodbye for now.